Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. National Chairman, Commissioners for Health Forum and Cross River State Health Commissioner want states with low vaccination coverage to give up vaccines to high-performing states. President Ramaphosa of South Africa hopeful Africa will produce vaccines as South Africa hosts technology transfer hub for coronavirus vaccines. A new study shows the Oxford, AstraZeneca and Pfizer COVID-19 vaccines to be effective against Delta and Kappa variant of the virus. The number of confirmed COVID-19 cases on the continent has reached over 5.2 million as of Wednesday afternoon, according to the Africa Centers for Diseases Control and Prevention, Africa CDC. They're saying the death toll from the pandemic stands at over 130,000, while over 4.6 million across Africa have recovered. South Africa, Morocco, Tunisia, Ethiopia and Egypt are the countries with the most cases on the continent, with South Africa recording the highest COVID-19 cases, followed by Morocco in northern Africa and then East Africa, while Central Africa is the least affected region on the continent. Let's see what's happening in Nigeria in this next report.
The latest figures coming from the Nigeria Center for Disease Control (NCDC) shows that Nigeria recorded 39 new infections reported from 5 states and the FCT. According to the agency, Lagos topped the chart with 17 cases, Borno recorded 7 cases, Ondo had 6, Rivers reported 5, while 1 case was reported in Kaduna. The latest tally also includes data from Borno State from the 5th of April to June the 17th, and 0 cases from Ekiti, Imo, Kanu, Oyo, Plateau, and Sokoto states. The total number of confirmed cases in Nigeria now stands at 167,331. 116 people have also been discharged after testing negative to the virus, raising the total number of recoveries to 163,913. No casualties were reported in the last 24 hours, leaving the fatality toll at 2,118. The latest date by the National Primary Healthcare Development Agency shows that more than 2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 950,000 of those vaccinated with the first dose have now received their second. In Africa, there are over 5.2 million confirmed cases of COVID-19 and more than 138,000 deaths on the continent. Across the world, more than 179 million confirmed cases have been reported, while deaths have surpassed 3.8 million. While the pandemic is not over yet, the World Health Organization is advising all to take the approved vaccines to prevent the further spread of communicable diseases such as COVID-19.
The Cross River State Commissioner for Health, Dr. Betta Edu, believes that some states with poor COVID-19 vaccination records might lose some of their Oxford AstraZeneca vaccines allocation to others who have shown high levels of performance in the vaccination exercise. Dr. Edu explained that the COVID-19 vaccines are not enough in some states like Cross River, which has exceeded 100% in the vaccination exercise. She was speaking in Benin City, the Edo State capital, during a South-South COVID-19 vaccination program organized by the Presidential Steering Committee.
Some states still have issues of vaccine hesitancy. In Cross River State, I think we overshot the first set that was given to us. We're leading the country with about 117% coverage of targeted population. We have received more vaccines, and we are also going to give this out. So in total, we have over 70,000 persons in Cross River that have taken the vaccines. There are some states that the vaccine consumption is really very, very poor, and we have to re-strategize at the central to see how we can pull vaccines from those states that the vaccine usage is poor and send them to the states where the vaccine is in high demand. The vaccines which we have presently is supposed to expire very, very soon. The vaccines in several other states are supposed to expire very soon, and we cannot allow this to happen as a country.
In Lagos State, the government is appealing to residents to get vaccinated in order to get protected from the coronavirus. The State Commissioner for Health, Professor Akin Abayomi, made the call after receiving his second dose of the AstraZeneca vaccine at the Folari Coker Staff Clinic in Alausa, Ikeja. Professor Abayomi says the vaccine should not be taken for granted because it is still the only medication that keeps people safe from the virus and also prevent a third wave.
We're vaccinating most people. It's not just frontline workers. So in fact, if you want to collect your first dose now, you can still come and get your first dose, and then we'll give you your second dose in August. Okay, so it's a continuum. It's not, second phase, first phase. We're just vaccinating those who have had their first dose. If it's time, they should come and collect their second dose. A date will be on your card, which tells you when to come. We will source other new supplies of vaccines, either from the federal government or from other agencies. Make sure they are the correct vaccine, and then we'll just continue to vaccinate until we achieve what's called the vaccine-induced herd immunity. So the federal government and Lagos State government and Mr. Governor is very particular that we do not go into a third wave. We don't want the economy to get another shock. So we're making sure that everybody who's coming into the country, we can isolate them and test them. Some people have been avoiding us. They've been trying to escape. We had a lot of people trying to escape at the beginning. But as you know, the federal government is now deactivating passports. People are being fined. Some people will be taken to court. If you're not a Nigerian, your work permit or your visitor's permit will be cancelled and you'll be deported.
While the focus of healthcare research and reporting has understandably been primarily on the COVID-19 pandemic, other diseases and conditions have presented a quietly growing threat, particularly in low-income and developing countries. The Nigeria Center for Disease Control, NCDC, has reported since the beginning of the year, 10,833 suspected cholera cases with 112 confirmed cases and 289 deaths this year alone. And in the last month, an increasing number of cholera cases has been reported across states. Well, joining us for more on this is Modupe Akinyinka, public health physician, Lagos State University Teaching Hospital, LASUP. She joins us on the program. Thank you for joining us.
Thank you for having me on the program. Good evening.
Good evening. Tell us, what's the connection, cholera and COVID-19?
Well, there's one basic connection actually between cholera and COVID-19, and that's the fact that when you engage in good personal hygiene, then you're able to prevent both at the same time, right? So that's a very key link between the two of them, even though they are caused by different organisms and all. Cholera is caused by bacterium, and then COVID is by virus. But basically, one of the key prevention, one of the key ways of preventing both is good personal hygiene, washing of hands.
What are the key factors behind cholera outbreaks? I mean, we appear to be seeing more cases now than before.
Okay, well, the key factors that would predispose people to cholera would be factors like poverty, and which, would predispose them to poor hygiene, poor sanitation, and then overcrowding. And of course, where there's poor sanitation, where there isn't adequate availability of safe water for consumption, then of course that would also predispose them to getting cholera. Hello?
The COVID-19 pandemic had, an impact on the measures to prevent and treat cholera. This is also including vaccination programs.
yes, we have vaccination programs for cholera as well. But the cheaper option to be able to prevent cholera really would be to ensure that people have access to safe sanitation and safe water. So adequate basic sanitation, that is proper refuse disposal, proper disposal of feces, right? So sewage disposal that is adequate. And then, of course, people have that knowledge of being able to ensure that they engage in proper hygiene, right? Washing of hands after the use of the toilet and before they start to cook, using safe water to be able to cook, and then ensuring that their food doesn't get contaminated as well, because cholera can be spread by water, contaminated water can be spread by contaminated food as well. So proper cooking of food and use of safe water to cook or wash foods that you know that you're not even going to cook, like fruits and vegetables, right? So availability of safe water is very important concerning the prevention of cholera.
And hopefully the prediction, preparedness and early response from COVID will also help us with something like cholera. We appreciate your time. Thank you so much, Modupe Akinke, public health physician with LASU. Thank you for joining us on the program.
Thank you for having me on the program.
All right. The Director General of the World Health Organization, Dr. Tedros Ghebreyesus, and South Africa's President Cyril Ramaphosa have announced that South Africa will be hosting a technology transfer hub for coronavirus vaccines to scale up production, information and education. President Ramaphosa said that this is the first step towards Africa producing its own vaccines in the future. Our South Africa Bureau Chief Betty Dibia reports.
South Africa has been at the front of calls for boosting not just Africa's access to vaccines, but also Africa's capacity to produce such vaccines on the continent. The Director General of the WHO, Dr. Tedros Ghebreyesus, announced what has been done about this.
Today, I'm delighted to announce that WHO is in discussions with a consortium of companies and institutions to establish a technology transfer hub in South Africa. The consortium involves a company called African Biologics and Vaccines, which will act as the hub both by manufacturing mRNA vaccines itself and by providing training to a second manufacturer called BioVac.
The BioVac Institute, based in Cape Town, South Africa, is a public-private sector partnership between the South African government and the Johannesburg Stock Exchange-listed BioVac Consortium, formed in 2003 to establish local vaccine manufacturing capability. An excited President Cyril Ramaphosa lauded the development, but added that the journey does not stop there, a view shared by his French counterpart.
Through this initiative and others, we will change the narrative of an Africa that is a center of disease and poor development. Today is historic, and we see this as a step in the right direction, but it does not detract us from our original proposal put together by India and South Africa that we should see a waiver of trips at the World Health Organization. We just cannot continue to rely on vaccines that are made outside of Africa because they never come, they never arrive on time, and people continue to die.
Every continent must have the ability to develop and produce its own vaccines and its own medicines. I am proud that the World Health Organization has chosen a consortium led by Afrigen and BioVac, a company that France has backed for many years, to establish the first manufacturing and training center for messenger RNA vaccines in Africa.
According to the WHO's chief scientist, Soumya Swaminathan, there are still several options on the table, mainly smaller companies and biotechs on one hand, and larger mRNA companies on the other, with a hope that they will come on board. Pfizer and BioNTech, along with Moderna, are the main producers of COVID-19 vaccines using mRNA technology. From Johannesburg, South Africa, Betty Dibia.
When we return, we have more on the regional hubs in a moment. Stay with us. Welcome back, and for more on the regional production hubs and open supply chains of vaccines to ensure equitable distribution, joining us right now is Tian Johnson. He's the founder, lead strategist, the African Alliance member, South African Ministerial Advisory Committee on COVID-19 vaccines, member and community engagement co-chair, African CDC COVID-19 African Vaccine Delivery Alliance. Thank you for joining us on the program.
Thank you so much for having us.
All right. First, what are your thoughts on how slow vaccination is moving across Africa?
I think it is absolutely outrageous. It is immoral, it is unjust, it is violent, but it is also the way the system has been set up to work. So the reality we see across Africa today is a direct result of a system that has been in place for years that was meant to do exactly what it is doing today. The inequitable access, the fact that we're seeing countries in the global north vaccinating young children who are at minimal risk of COVID before we in Africa can even vaccinate our healthcare workers is an absolute moral outrage. And there needs to be a lot more pressure put on those who are responsible for the condition we are in today.
With the regional production hubs we hear is coming to 4 African countries, are you optimistic? What do you expect?
I'm cautiously optimistic. You know, these regional hubs are not going to materialize overnight. This is a seed that has been planted and is a great seed. But like President Ramaphosa had said time and time again, what we need vaccines now. We cannot wait for facilities to start producing. We need vaccines now. We need to call on countries in the global north to share doses. We still have countries who are hoarding. So countries in the global north need to share doses immediately. Pharmaceutical companies need to come to the table urgently and wash the blood off their hands. It is because of farmer greed and inadequate government responsibility that we are in the position we are in today. So I do think the regional hubs are important, but they're not an immediate fix. People are dying today. This continent is in the middle of a third wave. We are seeing deaths like we've never seen before, some of the highest rates in some parts of South Africa today. So it's absolutely urgent. We cannot wait for those hubs. The hubs are good and we'll get there and we'll support them. But right now, we need equitable and urgent access.
I've heard a former president in Africa, of a country in Africa, say that Africa's main challenge is the lack of funds. It's not being able to harness available resources, that we have enough funds and we also have enough resources. And what's your take on that, especially homegrown solutions that are needed to address a challenge such as this?
I think we absolutely need homegrown solutions. I think part of the reason why we find ourselves in the place where we are today is because perhaps what we do own in terms of accountability is that we should have really been more proactive long ago. We've learned lessons from HIV. We should have been proactive long ago in terms of our manufacturing capacity to hit the ground running for this pandemic and certainly the next pandemic. I do not think it is a matter of money. At the outset, bodies within the African CDC, like Avad, have said, went to manufacturers and they said, we're not asking for charity. We do not want charity. We want justice. We are willing and able to pay for the vaccines. But what we need is the countries who are practicing greed in the global north to share their space in the queue. We need access to buy. But of course, all of that is in the context of this artificial global shortage that we are currently in. So it's not a matter of financing right now. What it is a matter of is about equitable access and giving up some places in the queue by those wealthy countries who are already vaccinating their children.
Just before we let you go, South Africa is facing a resurgence, a lot of people are wondering how fast is testing ongoing, and also what is the variant of concern at the moment?
Yeah, we've got the beta variant in South Africa. We've seen the rise of various other variants, Alpha in the UK, Delta in India, now we have Delta Plus. But we're not going to hear the end of these variants. We're going to see more and more variants and different types of variants. And this is a direct result of not vaccinating fast enough. The way we shut down the next deadly variant is by vaccinating people urgently. In South Africa, we've just tested over 70,000 people. In the last 24 hours, 166 deaths. We're in the full throes of a third wave. And so it's absolutely important that communities and those in power understand that the way to prevent the next super variant is to get as many people vaccinated now. The time is now.
We appreciate your time. Thank you so much for sharing your expertise with us. Tien Johnson, founder, lead strategist, the African Alliance. Thank you for joining us on the program.
Thank you.
COVID-19 vaccines made by AstraZeneca and the Pfizer-BioNTech alliance remain broadly effective against Delta and Kappa variants of the COVID-19 causing virus, which were first identified in India. This is coming from a scientific study underpinning a continued push to deliver the shots. Well, here's more on our global update.
According to a new study, the AstraZeneca and Pfizer vaccines remain broadly effective against the Delta and Kappa variants of COVID-19. Last week, an official analysis in the UK showed that the two shots provided 90% protection against hospitalization with the Delta variant, which the World Health Organization says is now becoming the globally dominant version of the disease.
As I said, we are not stopping at 70%.
And according to U.S. infectious disease expert Dr. Anthony Fauci, the Delta variant first found in India is the greatest threat to the United States' effort to eradicate COVID-19 in its borders.
Similar to the situation in the UK, the Delta variant is currently the greatest threat in the U.S. to our attempt to eliminate COVID-19. Good news, our vaccines are effective against the Delta variant. Conclusion, we have the tools, so let's use them and crush the outbreak.
Meanwhile, the United States will likely need a few additional weeks to hit its goal of vaccinating 70% of adults by July the 4th. In a news conference, German Chancellor Angela Merkel said the EU was not where it needed to be with common travel restrictions and that it's to blame for the case surge in Portugal. New coronavirus restrictions have been introduced in parts of Sydney, Australia's most populous city, following its latest virus clutter swelling to more than 30 cases in a week. Residents in 7 Sydney council areas have been banned from travelling for non-essential reasons outside those regions, while household gatherings are limited to 5 guests and masks will be compulsory in all indoor locations, including offices. The health minister in the Indian state of Maharashtra has ordered his staff to very closely monitor cases of a coronavirus identified locally as Delta Plus and advised states to increase testing. India said it found around 40 cases of the Delta coronavirus variant carrying a mutation that appears to make it more transmissible, with the earliest case from a sample taken on April the 5th.
COVID-19 isn't malaria. Continue to take responsibility. You can visit our website for more updates and a better understanding of the pandemic. You can find our head story there. Over 150 Texas hospital staff fired or quit over vaccine ruling. Lots of things are happening with regards to the pandemic around the world. You can find other stories. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.